Falafala Yatu, my name is Vili. I'm Niuean. I'm one of those migrant children that migrated to New Zealand with my parents in the late 70s. So a lot of my upbringing and education has been in New Zealand, but I do spend quite a bit of time in the Pacific region. And I do a lot of work up in Niue as well. As Jake said, I want to acknowledge the organisers, Maile, Angela, also your introduction, Jake, and also to the other speakers today. So that's a bit of brief background of myself. A lot of my work is mainly focused on health at the moment, but I have a social science background in terms of the work that I do. So as you can see from my title of my presentation, I put it up as the land of milk and honey in Aotearoa, New Zealand. And it's looking at ingenuity, Pacific, traditional culture concepts for health promotion messages. So one of the things that I've been trying to look at in terms of using our traditional culture concepts as a form of health promotion and improving our health profile for our Pacific people living in New Zealand, but also in the Pacific region. So next slide, please. In this presentation, I want to give a brief background on Pacific health in the Pacific region. So I'll talk about some of the key issues, some of the Pacific health challenges that we have. And I want to highlight some of the Pacific health issues in Aotearoa, New Zealand, and identifying what are some of these key issues that impact our Pacific people when we migrate and we settle in this land of milk and honey. And then I want to talk about two important things, which I'd like to present. It's a culture concept as a form of health promotion, but I want to also specifically look at our brother and sister relationship amongst our Pacific communities and also our culture. And then I want to end this presentation with a way forward, and I want to pose a question in terms of, will this actually work and how would it improve our Pacific profile for our Pacific communities? Next slide, please. So in the Pacific region, obviously it's a big, vast region that we do have in many Pacific countries in Polynesia, Micronesia, and also Melanesia. And I want to highlight in this particular slide some of the key issues that we have in terms of the Pacific region. So in the region, as you know, we live off the land. We grow our crops with our taros, cassavas, bananas, and yams. So we grow a lot of our products in the region. We also do a lot of fishing and hunting as a form of collecting food and also providing for our families. So one of the things that we have in the past is that we traditionally grow a lot of our crops. We live off the land. We eat the crops that we grow in terms of on the land. But it's also one of the key issues that I've seen and a lot of the work that I do is there's a lot of importation of unhealthy products that are not good for us, and it's actually impacting and affecting our health in the region. So I'll give you an example. What we're importing into the region is mainly mutton flaps and turkey tails. These are sort of the two common discussion points that we have amongst my colleagues and also many of my colleagues in the region is they're importing a lot of unhealthy products into our Pacific countries. We also have food security issues, different types of foods that we have in terms of our crops that we grow in terms of Pacific island nations. There are different crops and different agriculture products. Another key issue I want to highlight in this particular slide is climate change. We all know about climate change, big issue in our region. It impacts mainly Kiribati, Tuvalu, and Tokelau, many of the low-lying countries. So in terms of this climate change issues, we have changing disease patterns, food security issues that we do have. We're not able to grow a lot of our crops because of the land, because of the sea impacting the land. There's also loss of land where a lot of our crops are not able to be grown on this particular land, change in marine environment, and also we have a lot of climate disasters in many of our Pacific countries. Next slide, please. This particular slide gives you a bit of an idea of some of the issues that we have. And as I said previously, mutton flaps, as you can see from this particular slide in Tonga, it's classified as it's not a good product for us to have in this particular region. We have high rates of diabetes. Our life expectancy is falling because of some of these cheap, fatty kind of meat, which is mainly imported from New Zealand. So we're actually importing a lot of these unhealthy, products that are not good for us in terms of importing in these countries. Next slide, please. So a quick snapshot, some of the key Pacific health challenges that we have in the Pacific region. Non-communicable diseases. This is one of our biggest killers that we have in the Pacific region. It's a big issue for us in many of our Pacific countries. It's probably the #1 disease that we have in many of our Pacific countries. We also have infectious diseases. This impacts many of our Pacific countries. We've had this for many centuries and in many countries. Maternal and child health are often a big issue in many of our Pacific countries, where access to services, resources are quite limited. Adolescent health is another key issue for many of our young people. It's often impacted in terms of their mental health and some of their social issues they do have. Also want to highlight injury. We have a lot of injuries in the Pacific region, mainly around accidents, in terms of issues that we have for many of these Pacific countries. And then I want to highlight mental health. We all know about mental health issues. That's a real big impact in many of our Pacific countries throughout the region. So it is an important factor in terms of some of these issues. So just as I said, this particular slide gives you some idea of some of the Pacific health challenges that we have. And I just kept it quite short in terms of this particular presentation, but these are some of the key issues that we do have in the Pacific region. Next slide, please. So I've given you a bit of a snapshot about the Pacific region, some of the key issues in terms of the health profile, and some of the key issues around food security, some of our diseases. Now I want to look at New Zealand. So we're moving to New Zealand, we're migrated here. So as you can see from this particular slide, our Pacific population makes up 8% of the total New Zealand population. Samoan population is one of our biggest populations that we have here. Then we have the Cook Island Māori, which is 21%, Tonga 20%, and Niue, which is where I'm from, we only represent 8% of the population. So as you can see, population numbers are quite big in terms of Samoa, Tonga, Cook Island, and also Niue. Most Pacific people live in the North Island, such as Auckland, in terms of migrating and settling. So a lot of our Pacific people tend to migrate on the North Island and tend to settle in Auckland, because that's where a lot of our Pacific families are settled, and a lot of our families, come and stay with many of our relatives. And I know many of our Pacific people do that. It's a form of moving to a country, you settle with your families, and you make a new lifestyle for work, education, and a better lifestyle. Next slide, please. So this particular slide, it gives you a bit of a snapshot. We've settled in this country, but we've also encountered many health issues that we do have. So as you can see from here, Pacific people die younger. We have high rates of chronic diseases. Our respiratory diseases are quite high in terms of COPD, pulmonary diseases, asthma, bronchiolitis. Hospital admissions are very high, which is linked to deprivation status. Cancer, lung cancer and primary liver cancer, again highlighting that some of the issues are quite high. Cardiovascular diseases, mortality rates, and diabetes. Diabetes is one of our biggest issues we have here in New Zealand in terms of Pacific people. Access to healthcare is a problem, late presentation, late diagnosis, smoking, and differences in cancer rates. So these are some of the key issues that I just want to give you a bit of a snapshot in terms of our Pacific health profile here in New Zealand. Next slide, please. So what I've done here is I'm going to present to you a key concept. It's not new to many of our Pacific colleagues and our communities. I want to use a form of culture concept as a form of health promotion. So the key concept that I want to highlight here is the use of our brother-sister relationship and using it as a form of positive health messages. So in many of our Pacific cultures, we have a common element, our brother and sister relationship amongst our Pacific communities. And I want to see if actually, in terms of this brother and sister relationship, is it going to make an impact or influence in terms of improving our health profile? Next slide, please. As you can see here from here, I want to highlight some key issues around, and I'm mainly going to look at the 4 key Pacific groups here in New Zealand, which is Tonga, Samoa, Cook Island, Niue. So in the Tongan culture, we have the whahu, which is the father's oldest sister, the highest level of respect in formal occasions. She is the family matriarch and oversees her siblings and nieces and nephews. So the whahu, it has, this sort of relationship in form of leadership in terms of the family and in terms of their status. In the Samoan culture, we have the whianganga. There's a specific code and etiquette, and I know some of my Samoan colleagues can maybe expand on this and ask me some of the questions that I may miss here. So here the brother is responsible for his sister's safety and general welfare. So they're responsible for looking after their sister. Next slide, please. In the Cook Island culture, we have the tungane toine special brother and sister relationship. So this is, again, it gives you a concept in terms of the brother protecting the sister and protecting their younger family members. In the Niue culture, we have the umotua, which is the role of the brother to look after the sisters and also the unmarried sisters and children. Next slide, please. So in this particular example, I want to give you, one of the studies that a good colleague of mine, Dr. Tuila Purcell, and a few other of my colleagues, they did a study around Pacific people's violence and the power of control wheel. So in this study, they used the brother-sister covenant as a form of protective and preventive factors against sexual health for each particular culture. So the brother and sister, it's a significant relationship. It's seen as protecting the sister when there's issues around sexual issues amongst the sisters. Next slide, please. So it also extends to the, to the extended family, close cousins, relatives, children of the family. So there is a brother-sister protective relation between, the male and female, the brother and sister, looking after the sister. Tongan views as this the anga whakatonga. It's also that relationship looking after, again, the sister. There's also the respect notion in the Tongan culture, looking after your sister. And then lastly, a sister outranks the brother. So there again, it offers that leadership in terms of protecting and looking at our Tongan culture. Next slide, please. This slide here is one of my master students, Tongan student. She looked at she completed her master's in public health, which looking at smoking amongst Pacific Northern in the Auckland region. And what we wanted to explore here is looking at the term of whahu and how it was used as a form of leadership and providing support in terms of smoking. So it was a thesis. She did 20 interviews of Tongan women. As you can see, for some of the results we found, it was stressful leaving, friendship, rites of passage, smoking is bad for you. There's also issues around accessing smoking cessation services. They felt it should have been in the community, not so much going into the clinics, so they needed to bring it into community. So one of the things, the key recommendations that we found that the brother and sister relationship can be utilized to support smoking cessation, where they have the leadership and power to say no smoking or banning smoking in terms of many of their cultural and family functions. Next slide, please. So in ending my presentation, I want to pose these two questions. How my work engage with Health Pacific Island Diaspora and Ingenuity. So the 2 points I want to highlight here, the practice of the brother and sister relationship, it can be used as a form of promoting positive health promotion messages. And this is a way that we need to sort of look at it as an example of what can we use in terms of our culture, in terms of our tradition, and how we can use it as to improve our health profile. So my last point here, and I want to put this as imposing out to the audience, will using our traditional culture content make a difference to improve our poor health disparities here in Aotearoa, New Zealand? So this is a question I want to leave here in terms of my presentation, and I hope it gives you an idea of some of the work that I'm doing here in New Zealand, but also in the region. And my last slide, please. This is my homeland in Niue. This is where my village is in Amasele. And this is the only beach that we have in Niue. And this is where I was born and migrated. As I said, I'm a migrant living here in New Zealand, but I have some strong ties up in Niue. So whakaolai for listening to my presentation, and I hope it gives you an idea of the work that I do and just to pose some questions around and using our traditional cultural practices. So thank you.